Kaçtan gitti? Baba ne kaçtı?
Thank you very much, Dr. Udai Prakash, and all doctors, Udai Omni Hospital. Udai Omni Hospital, best of the best.
Hello friends, this is Dr. Udai Prakash. I'm a consultant orthopedic surgeon at Udai Omni Hospital in Hyderabad. I specialize in primary, complex and revision joint replacement surgery, as well as management of ligament and cartilage injuries of the knee secondary to sports or accidents. Recently we received a very heartwarming video from a patient who lives in Uzbekistan. She was ever so grateful to us for helping her walk again. When she came to us over 2 years ago, she hadn't walked for months due to pain in her knees. Just to give you a little background, we received a message in early 2018 from her son who wanted to bring his mother for knee replacement surgery. Of course, we said you're welcome to that, and within no time they were here, landed in Hyderabad in March 2018. We sent our ambulance over to bring her over to the hospital, but to our surprise we found that she was nowhere close to having a surgery done because she had many medical issues. She was a 58-year-old lady with chronic liver disease, obesity, low platelet levels, hypertension, obstructive sleep apnea, and other conditions like history of pyelonephritis and kidney infections. So she was in no state to have surgery, and what we did was we recruited a lot of different specialists, which included physicians, cardiologists, pulmonologists, and our anesthetic team, and we got together to try and get this lady back to fitness again so that we could operate on her. So the other thing was they spoke very little English, and we had to recruit a Russian interpreter to help us manage her. On occasions when the interpreter wasn't in the hospital, we used Google Translate to help understand each other. So what happened was over the next 10 days, this lady received treatment from various specialists, and this involved insertion of an inferior vena cava filter that was essentially put in to prevent clots from reaching her heart and her lungs. We felt that this was important because she had a very big chance of throwing clots during surgery. The other issue that was bothering the family, but not particularly the hospital, was a limited budget. They had enough just to undergo surgery, but not enough to undergo various investigations and other treatment that was required to get her fit for surgery. But we reassured them and said that we would try and manage and help our friend from Uzbekistan as much as possible. Prior to surgery, she also underwent an endoscopy to treat a large ulcer that was there in her stomach, and also to put a band around esophageal varices, which are basically dilated blood vessels that can bleed during stress, particularly perioperatively. Over the ensuing days, her blood oxygenation levels improved, her medical condition improved, her liver disease seemed compensated, and we felt she was ready to undergo surgery. Our highly professional anesthesia team, led by Dr. Krishna Prasad, pulled in all their experience to give her safe anesthesia and to monitor her closely during surgery. Myself and my team got down to what she came to Hyderabad for, and we performed 2 technically challenging knee replacement surgeries. Luckily for her, everything went smoothly. On one side, we managed to put in a partial knee replacement, and on the other side, we managed to put in a full knee replacement. Post-operatively, we were fortunate to have see this lady undergo a smooth recovery. However, because of chronic illness, her strength wasn't enough to get her walking early. So she stayed with us for about 7 days to 8 days post-operatively, and during this time we managed to get her standing and to take a couple of steps. The son, as well as the family back in Uzbekistan, were extremely concerned about her long stay in Hyderabad, so they decided to leave a little earlier than we would have liked. Luckily for her, she managed to fly back to Uzbekistan safely. Over the ensuing months, she underwent painful physiotherapy locally, but eventually started walking. Recently, we received a wonderful video of her walking up and down the street, up and down the steps, and thanking us profusely for helping us get her life back again. So with this wonderful story, I would like to thank everybody in the hospital who helped us get this lady back alive again, her walking again, and to this I'm eternally grateful to everybody who helped me achieve this. Thank you.